She's going to talk to us today about healthcare disparities for rural populations and others, and particularly with a focus on cancer survivors. And she's also going to talk about the collaboration that she did with us through the Mind Your Beat intervention and how that went. So yeah. Anyway, without further ado, here is Dr. Mama.
Uh-oh. Something happened. Maybe when she started recording. Working?
Sorry, we're having more technical issues.
I was like, do you want me to just use yours if you have it?
I have it.
Yeah.
Yeah.
You want to do that?
Let me pull it up through my email and yep. Okay. Okay. Ooh, Google Slides. So I hope. Okay, let's do this.
Oh, we go.
Yeah. Oh, sorry, my computer's trying to load it. Okay.
I was gonna say, mine just did a whole freak out.
Let's do this.
Gotta love technology, huh? Yeah.
Okay.
Right.
Instead of that be the big cheap tablet and a pencil.
That's right. I, if I had a copy of it, I would just talk about it. It's so intimate and, oh, but there's 4 people.
Okay.
Online, right?
I think we're good.
We can put that in
Okay.
there.
I think mine is up and here.
I'm sharing too. Okay.
If it'll, yeah.
Yep.
Okay.
Then can I bring it up here?
Yep.
Or do you want me to do it here? I don't have to be on the podium. Do you think it'll reach? Oh, sure will.
I wonder if we set it on.
That's not here. Yeah. And yours is here?
Yes. Okay.
Successfully detected. It's always a good sign. Okay, excellent.
Not going.
Oh, yeah, you can.
And
Oh,
maybe
just
just
put it
move
up.
it.
Yeah, and
Okay.
it'll go away, I think, eventually. Here we go. Okay. Make sure, okay. So, sorry about that. And I think also this thing will go away too. So, my name is Dr. Scherezade Mama. I go by Cher. I'm an associate professor in health disparities research at MD Anderson. So I'm coming to you from Houston today. I'm excited to be here. I have been working with Courage Health now for 4 years, almost 5 years. And so I'm excited to share some of the work that we've done. I know we had a question about, what is health disparity? So let me start off with that. Oh, there we go. Can they all hear me okay?
Yeah.
Okay, good, perfect, excellent. Okay, so health disparities, it just means that my job focuses on exploring differences in health outcomes between various groups of people, right? That could be by and looking at differences between men and women. I do a lot of work looking at racial and ethnic minorities, so differences between, let's say, Black adults and Hispanic adults, or white adults and Black adults. I do a lot of rural urban differences, so that's what I'm going to be sharing today. So I started off my career in Pennsylvania. So I'm from Houston, did my postdoc at MD Anderson. I moved to State College, Pennsylvania, which if you're familiar, how many of you are familiar with Pennsylvania? Not at all. Oh, okay, some. But I was smack dab in the middle of the state of Pennsylvania, so quite rural. There's a big university there, but outside of the university, not much else. And so that's where I started working in rural cancer health disparities. I'm going to share some data with you on why I focus on rural cancer disparities and why it's important. And then I moved to Texas, so back home and back to MD Anderson. And so I've continued my work in rural cancer health disparities in this Northeast Texas area. Tyler's not rural, so we'll say that, but a lot of the surrounding parts of Tyler are. So
You drive like it is.
we drive like it is. Do you mean distances or speed? Both. Exactly. Okay, so let's see. About 2 million people are going to be diagnosed with cancer in 2025, right? This shows the top cancers in men and women. And so you can see for men, the number one cancer is going to be prostate, followed by lung, and then colon or colorectal cancer. In women, very similar. Breast is the leading cancer incidence in women, followed by lung and colorectal cancer. But cancer doesn't affect everybody the same way. So this map shows rural urban differences in cancer incidence, and then where we can see these differences. So the darker the color gets on this map means the greater number of cancer cases we tend to see. So here you can see, you know, we're not doing too terrible in Texas, right? I think it's because we're so large, but we're in that yellow color on the first map. Can y'all see that okay? It's very pale. You see it okay? Okay. And then the darker blues are where we see higher cancer incidence rates. What I really want to draw your attention to is the map on the right. And that's where you can see the differences between metropolitan cities and rural cities, right? So this is for all cancer cases, right? Or all cancer types, all kinds cancer incidents. The blue means metro cancer incidence in metropolitan cities is higher. The orange means there's no difference. The rural and the urban are the same. And the blue means that there's higher rates in rural areas in these particular states, right? So for all cancer types or across all cancer types, right, we don't see very many differences. But I'm going to alert you to some specific cancer types, right? So here's a different map. This looks at rural urban differences in lung cancer incidence rates. And so here you can see Texas now lights up in green on the left side, right? So the cancer incidence rates are higher for lung cancer in Texas in particular. You can see also the dark blue is kind of concentrated in this Midwest/South area. On the right, you can see the differences, and this is where we start to see some of these disparities, right? So lung cancer tends to affect rural populations more so than urban populations. You can see higher rates of lung cancer incidence in these rural areas, AKA the blue, right? Versus green, where there's higher in metro, and orange, where there's no difference. We see a similar pattern for colorectal cancer. So again, higher rates of colorectal cancer in Texas. We start getting into that blue coloring on the left. And then if you look at the map on the right, you can see the rural areas in these particular states, higher rates of colorectal cancer incidence than the urban areas in these particular states, right? And so you can really see these rural-urban differences or disparities in outcomes. We see similar patterns for deaths. So here are about 500,000 people are going to die from their cancer in 2025. And you can see the leading causes of cancer mortality. So in men, lung, prostate, colorectal. In women, lung, breast, pancreas, followed by colorectal, right? And we see similar patterns in these rural-urban differences. So these maps look a little bit different. On these maps, we're moving from left to right, okay? Left is the most metropolitan area, so areas with over 1 million people. The middle is kind of these counties where it's a metropolitan area, but has fewer than 1 million people in it, or maybe very adjacent to a large metropolitan city. And on the right-hand side, you see non-metro or rural counties. And what I really don't focus on the details, I think what I'm trying to show here is that as we move from urban to rural, you can see the cancer death rates increasing. This is true for all cancer types, right? And particularly concentrated here in the South. And that's in men. And then same is true for women, although lower incidence of cancer in women, but same pattern, right? Where we move from left to right and the color gets darker over time. And so this is why I work in this space, right? More people are likely to develop cancer in rural areas in Texas and across the United States, and also die from their cancer in these areas. Here are some other rural-urban differences. So residents of non-metropolitan or rural counties are 38% more likely to develop and die from lung cancer. Women in rural areas have a 37% greater incidence rate, so they're more likely to develop cervical cancer, and a 39% greater mortality rate, also more likely to die from cervical cancer. This little figure shows you that the percent of likelihood of dying within 5 years of a colorectal cancer diagnosis is not only higher in rural residents, but it's specifically higher in rural Black residents living in the area. Cancer is not the only thing that contributes to rural-urban differences or disparities. Rural adults are more likely to develop and die from multiple chronic health conditions, including cancer. There's also heart disease, unintentional injuries, respiratory disease, and stroke. So rural is in this dark brown bar. And what you want to take away from this is that, you know, as you get more rural and your incidence or your likelihood of dying or developing and dying from chronic diseases also increases. That was morbid. I'm a physical activity researcher, so I really like to improve health outcomes, right? I focus on these things and what we can do, what's within our control. And so physical activity, we know, plays a key role in cancer prevention and survivorship, right? So we have certain guidelines for cancer prevention. We know being physically active is associated with reducing your risk of 13 different types of cancer, right? Some of the most common ones shown there. We also know that it's important to remain physically active during treatment and after treatment. And we have very specific recommendations on what you should be doing after cancer treatment. And so generally, for the healthy adult population, we say that folks should be doing 150 minutes of moderate or greater intensity physical activity each week, plus muscle strengthening activities on at least 2 days per week. For cancer survivors, we typically say you should be doing physical activity for at least 30 minutes 3 times a week, and you should work your way up to those guidelines for healthy adults. Plus, incorporate those strength training or resistance training activities, right? And not only do we think it reduces your risk of chronic diseases, it reduces your risk of recurrence, cancer recurrence, and improves survivorship outcomes, but it also helps with a lot of treatment-related symptoms, right? So helps with fatigue, helps improve quality of life, improves physical functioning, reduces anxiety and depression, helps with sleep, can help with lymphedema, helps with bone health, right? Post-cancer diagnosis, and a multitude of other things where we're still developing evidence for. But are people doing it? And the answer is no. Phew, I already got a head shake over here from Kathy, right? And so the vast majority of folks are not meeting physical activity recommendations. So in healthy adults with no history of cancer, only about 25% of the population meets physical activity recommendations. Same is true for cancer survivors, right? Here you can see the prevalence meeting recommendations broken down by age, right? So younger, we know physical activity declines with age. That's not too surprising. The purple is the folks meeting recommendations. The blue are the folks not meeting meeting aerobic recommendations and meeting both aerobic and strength recommendations, which is why it's smaller. And what you can see from this is, well, very few people are actually meeting both, right? More people are likely to meet aerobic recommendations. Why? Because it's easier to go take a walk than find a gym and do strength training and things like that, right? But even then, only 30% among younger cancer survivors and just over 20% for older cancer survivors, right? And so we have lots of work to do in this space. If we go and look at it in rural cancer survivors specifically, which is what I did in Pennsylvania, you can see that there is a large proportion of folks not meeting recommendations and not doing any leisure time physical activity at all. So here you can see in rural areas in orange, over 50% report doing absolutely zero physical activity, right? Then you can see what it looks like for both aerobic and strength training recommendations on the far left, right? Among rural adults, only about 15% are meeting recommendations and compared to about 20% in urban populations. So again, more work to be done in these places. And then I think another part that's a little troubling is that people who are not meeting physical activity recommendations tend to experience greater psychosocial distress, right? So I talked about how physical activity helps reduce anxiety, manage depressive symptoms, and improve quality of life and psychosocial well-being post-cancer diagnosis. And what we can see here is that folks who are active are less likely to be stressed or report perceived distress or depressive symptoms compared to those who are inactive or sedentary, who report higher levels of perceived stress and depressive symptoms. Unfortunately, there just isn't a lot. I'm not going to go into the logistics of this. This is just to show you that there's just not very many studies out there. We tend to use systematic reviews and meta-analysis as a way to examine the evidence, a body of evidence in a space. So this was a systematic review and meta-analysis that looked for physical activity interventions that were developed specifically for rural cancer survivors. And what we found was there were only 7 studies worldwide. So like not in the US, just 7 studies worldwide. Again, contributing to this, like there's just not a lot out there to promote physical activity in this population. And across these studies, even after participating, most folks were still not meeting recommendations. So again, lots of work to do. So my goal was to develop a physical activity program specifically for rural cancer survivors or people residing in rural areas. And I wanted to do this by not reinventing the wheel. We have lots of physical activity programs that are quite effective in other populations. So my goal was to use this staged approach to adapt an existing program that has a lot of evidence that it works, specifically for rural cancer survivors. And to do this, we, culled through the evidence base, saw what was out there that works for others, and then we talked to folks. We talked to rural cancer survivors and we talked to community organizations that serve rural cancer survivors, both in Pennsylvania and here in Texas, and came up with a program. So we built our program in that way. So I'm going to walk through it relatively quickly. This is the evidence-based program that we started with. The title of it is called Beat Cancer. It stands for Better Exercise Adherence After Treatment for Cancer. And it was developed by this woman, Laura Rogers, at the University of Alabama at Birmingham. And it is a randomized trial with lots of evidence-based. It's been conducted at multiple sites and over long periods of time to show that this particular aerobic exercise program was effective for increasing physical activity and improving quality of life in breast cancer survivors. But there's some differences to this program and the program that we developed, right? So Beat Cancer was originally developed as like a one-on-one supervised exercise training program, meaning that cancer survivors in this program came into a research lab. They exercised on a treadmill to complete their aerobic activity with an exercise specialist. And then the program transitioned to a home-based program. That was the goal. It wanted to reach people in their homes, right? Or help them, give them skills so that they could do it long-term. And so the whole idea was it started as a very intensive in-person program and then tapered over 12 weeks to a home-based program. And that's why we thought it'd be a good fit for our rural cancer survivors. And we started with this program. The bones of this program, I guess. Beat Cancer is guided by a theoretical framework, which is called social cognitive theory. And social cognitive theory emphasizes that it's personal factors, environmental factors, and behavioral factors that determine whether you adopt a behavior or not, right? And so at the personal level, there are things like self-efficacy. Are you confident you can engage in a physical activity program? Are you confident that you can stick with it even when things get tough, right? You have scheduling conflicts, the weather's bad, your kids are asking for a lot, all these things, right? So that's what self-efficacy tells us. In the environment, you may or may not have somebody who's supportive of you engaging in a physical activity program. Social support comes in lots of different shapes and sizes, right? One form of support that I think we're all like, when we think of social support, what do you think of? Tell me. Participatory. Like if I was like, do you have somebody who's supportive? You know, what do you think they do or say? Don't you have, oh, okay. They hold you accountable, right? Don't you have class today? Or they encourage you to go to class today, right? Maybe they say supportive words like, you're looking great, you're doing great, you're getting stronger, you know, something along those lines, right? So that's one form of social support. Another type of support, so let's say you are a working mother, right? And it's like, don't you have class today? Do you want me to watch the kids so you can go for 30 minutes or an hour? That's what we call like tangible support. So we look at all of these things, like what type of support do you have and how does it influence your behavior? And then we think all of these things impact whether you intend to do some behavior. Once you start doing the behavior, you get this what we call a mastery experience, because you start doing it and now you know you can do it, right? So it kind of reinforces the behavior with some positive reinforcement. And so Beat Cancer has all of that incorporated into it. It has exercise sessions facilitated by an exercise specialist. It has a little notebook, so it shares information with folks related to physical activity and cancer and why physical activity is important. It translates into a home-based program. I think that gives autonomy and independence, right? Promotes those mastery experiences. And then there's two other pieces of Beat Cancer that are kind of unique to maybe what you've been doing in Courage Health. It has individual counseling sessions with an exercise specialist. You may be doing that if you're doing supervised one-on-one exercise, but then it also has a group counseling session where they share information on behavioral skills techniques, right? How to monitor your physical activity, how to come up with a relapse plan. So if you get behind, it's okay if you didn't meet your goal last week. Let's get back on track. And some of those goal setting and other strategies. And what they found is, well, it works, right? So the people in gray are the ones that were not in the program. The people in blue are the ones that were in the program. And here you can see accelerometer is a measured physical activity device versus self-report. But you can see, regardless of how they measure physical activity, the people in the program increase their physical activity over time. They also looked at other outcomes, including physical health or physical function, mental health, physical health, mental health, and physical functioning, and saw improvements over folks who did not participate in the program. So I'm going to go back to my staged model. We think we have our evidence program, right? So we started with Beat Cancer. Our next step was to talk to folks and see what are their needs, what are their preferences, what do they want to do, what are the barriers, and then to talk to organizations. How can we actually make this work in the community? So we talked to a lot of rural cancer survivors. We had about 219 people, 263, I think, in this portion of it, that shared their preferences for physical activity with us. And overall, you can see there was either no preference or preferred individual format for physical activity. Most folks said that they would be more likely to exercise at home than at a gym. We asked if they'd be more likely if an instructor walked them through what to do. They said yes. And then we asked, would you be more likely to exercise if your oncologist told you to exercise, right? And a lot of folks said yes, not too surprisingly. When we asked what stops you from being physically active or meeting those goals right now, most cancer survivors said treatment-related side effects, fatigue, bad weather. It doesn't fit within the schedule. I have a lot of things going on right now, right? Maybe some of those treatment-related side effects made them feel ill, so they were unable to exercise. But then the other people also said, I'm not sure what to do. I'm afraid of getting injured. I feel self-conscious when I do it. These are all very addressable barriers, right? So we wanted to make sure that we address them in our program. We did that survey first, and then we followed up with people in an in-depth interview. So we had 38 rural breast cancer survivors participate in our interviews. And what we found was when we asked them, what helps you to be physically active? They said, well, I know I have physical health benefits when I'm active. I know I feel better mentally and physically. And, you know, having something accessible to me in my community helps me be active. When we asked about barriers, they said, well, side effects, cost, a lack of support or feeling socially isolated in a rural community, and then sometimes not having access to resources. So here's some quotes from participants. This one says, I know I feel so much better when I exercise. I can keep muscle spasms and arthritis pain in my back and neck under control. And that's the motivation. It makes you feel better. So why wouldn't you do it? And she was 77 years old. Another participant said, it helped me stay sane and not give up. I was in the fight for my life, and being able to walk and breathe was healing. When we talked about some of the barriers, one participant said, joining a gym with a swimming pool. The oncologist said that would probably be good exercise, but it's just too expensive. So cost prohibitive, right, was a barrier. Another one said, I think one would be just sometimes not having someone to do anything with. It's usually just kind of limited that way. I think maybe that would be a barrier, just wanting to find someone to partner with and exercise with. We also asked about how various rural community characteristics impact physical activity, right? So feelings of social connectedness versus feeling isolated in your rural community. Are there aspects of the neighborhood or built environment that can contribute to physical activity? And then are there resources nearby that can help you to be physically active? I'm just gonna make sure that everything's great. Oh, okay. Making sure that they weren't like, I can't hear you anymore. Stop talking. Okay. So here's one of the things one of our participants said. Our town is smaller and I like it because you know more people. I usually meet someone that I know every day if I'm out running errands. So this feeling of like social connectedness with their small town, right? Oops, I keep pressing the wrong button. There we go. Then this is a con of living in a rural community. So one participant said that period till I got through radiation and surgery, radiation and all that, it was very dismal because of a lack of support, a lack of services. I had to go 2 weeks for radiation. I had to drive myself. There was nobody to take me because my kids were at work. There's no bus service. And it was just really, really tough. I remember doing this interview myself. I was a faculty member at Penn State and my graduate research assistant had called in sick that morning. And I was like, well, I'm not going to cancel on a participant, right? And so I was like, I'll go meet her. And I remember driving 20 minutes up a mountain. She met me at the bottom at a mailbox, some random location. And she goes, Google won't get you here. So she met me at this mailbox and then we drove up this mountain, no cell service. And she had this beautiful little cabin in the woods, right? Very rustic, very small. And I remember her husband being there. They were clearly hunters, right? Dressed in complete camouflage and, very much worked the land and did things like that. And I remember, and I was like, oh, are you okay with him being here? She goes, oh yeah, it's fine. And he literally sat on a sofa right here. And we sat at their dining table right here. And I remember her talking to me and I asked the question about, tell me about social support and how that helps you or hinders you to be physically active. And the second I asked this question, she immediately starts crying. And I was so taken aback because she seemed so strong, like physically and mentally in that moment. And the second I asked this question, she's like, nobody's ever asked me that before, and then she went on and told me her story about how she had to drive herself to radiation. Nobody was there to take her, how alone she felt through her cancer journey, right? And it just kind of reinforced that we need to do better, right, for folks in these areas. So another participant said, our roads are dirt roads. We have no sidewalks. We have no playgrounds for children. I mean, healthcare is half an hour away to an emergency room or anything like that. So services in this area are very slim. Here's a positive. In my community, everyone walks. You see people all the time walking around. There's no bike paths, but everyone's biking. They just use the roads. You just walk on the roads. There's also an easy hiking area. You can just go down a couple blocks, like a mile, and you're in the woods. And you can just hike and walk at any time. I always joke because I was like, a mile isn't a couple blocks to me, but I mean, like maybe we have different experiences growing up, right? So there's this very like tug of war in these rural communities, right? There's lots of bright spots, lots of great things about these rural communities, but then also a lot of things that can make it hard to be physically active and can impede both physical and mental health. So we learned from our cancer survivors. Our next step was to go to organizations and ask them, why are you not offering these services to your cancer survivors? Most organizations felt like physical activity was important. It would be beneficial. but few felt that they had the support or the resources to implement a program, right? Money and space, those are always the two biggest barriers to doing something. And so they didn't have the money and they didn't have the space to implement a program. So this is just me showing that, we did our part, right? This is like a framework for adapting interventions, and we made sure we targeted each of these levels of adaptation in putting our program together. And then right around this time, I moved to Texas and I met Trevor, right? I literally went on a website. I was talking to folks. I was talking to oncologists in the area, actually in Tyler, MD Anderson and Hope Cancer Center at the time were having this budding partnership, right? And so I connected with a few people at Hope. And so, I talked to them first. And every single time I talk to an oncologist, they go, have you heard of Fit Steps for Life or Courage Health, right? And I was like, no. And then I go, you should really talk to them. Okay. And then I went to the next oncologist and I was like, tell me more about physical activity program and your beliefs on exercise. And they were like, have you heard about this program? And I was like, no. And they go, you should really look into that. So I went online, I did a Google search, I found them. I think I submitted a contact us form online and Trevor immediately responds to me. It was almost immediate, I think. I don't believe that, but immediately responded and we got a call set up right away. So we came and we talked to cancer survivors in this Northeast Texas area, and we heard a lot of the same things we heard from our cancer survivors in Pennsylvania. But here are some unique things that we heard. People wanted programs that meet them where they currently are and encourage even the smallest amount of activity. Don't go asking me to meet the physical activity recommendations when I'm just trying to get off the sofa today or trying to get out of bed. And so go, we hear you. Let's work on that. They wanted us to provide multiple options for being physically active. And they wanted sessions that are flexible, offered at multiple times, are held somewhere easy to get to that feels safe, and they wanted a mental health component. So remember that piece because it'll be important later. One participant said, depression can prevent you from doing anything. Especially physical activity. So your mind has to be right as well. When we talked to our community partners, including Courage Health, they told us there's a need for more education on the benefits of physical activity and physical activity programs that address emotional needs. Programs need to be convenient and accessible. A lot of folks told us we needed to use trusted members in the community. Don't come from Houston and try to implement a program here. Use the networks that already exist in this area. So we heard that too. They wanted us to encourage activities that are fun, that focus both on the mind and the body, and that could be incorporated in part of people's normal lives. And so this is where partnering with the Fit Steps program, now called Courage Health, was really a good match. So here we are, putting it back together and developing what I call a Frankenstein of a program, right? We started off with Beat Cancer. Beat Cancer had some important pieces that we could take from it, right? Specifically related to like the behavioral skills training. We knew that helped people be more physically active. Teach them how to do physical activity monitoring, set goals, right? Develop these mastery experiences, evaluate the support, all of those things. Next, we heard from our cancer survivors that we needed to address both the mind and the body. So we decided to incorporate yoga exercises as part of like strength training exercises, in addition to the aerobic activities that people were already getting as part of BEAT. And then we partnered with Courage Health, right? Give me something in my community that I can incorporate as part of my everyday life. Give me a location that is safe. And working with Courage Health was perfect for that, right? Because of their wide variety of existing offerings. And we called our program Mind Your Beat. I was going to add Fit Steps in it. And Trevor was like, I don't think it has longevity. Don't do it. So I was like, okay, I'm glad I listened. So Mind Your Beat is the program we ended up with. So let me take you through Mind Your Beat. We worked very closely with Courage Health and we offered the program to everybody who's already enrolled in the Courage Health program, right? Courage Health is unique. Have you two participated in Courage Health previously? Okay, I'm getting a head nod. Did you participate? Yes, okay. So you're familiar with the program, right? And all it has to offer. So I won't go into the details, right? The unique thing, which you are so fortunate in Northeast Texas, right? I always call this like a golden goose. I stumbled upon it. I'm so glad I did. But getting an oncologist to refer somebody to an exercise program is extremely unique, right? It is extremely unique. We usually cannot get physicians to do much other than treat, right? Consult. Do things. Yes, I know. Exactly. Dr. Lee's one of the first people well, she was actually the third person I talked to, and I was like, that's it. I'm contacting this program, right? And so, it is quite a unique program. If you went anywhere else in the States, it would be almost impossible to find, including at MD Anderson, right? We don't have oncologists that refer people to a physical activity program, let alone write a prescription for them for it, right? And so I knew I was stumbling into something magical. So I wanted to work with them as closely as possible. So we offered Mind Your Beat to folks that were already in Courage Health. They had to meet our eligibility criteria, which I'll go over in a little bit more detail in a minute. Participants who were eligible were then invited to come and complete a baseline assessment. We ran it out of First Christian Church. So you may have seen us hanging around if you participated there. Came in for a baseline assessment where we did some height, weight, blood pressure measurements. We did a 30-second sit to stand test to measure physical function. People completed an insane number of questionnaires because I am a very curious researcher and I want to know everything under the sun. And then we outfitted them with a little device called an accelerometer, which they wore on their wrist. This is a wrist-worn one. So it looked like a watch, but it measured physical activity, gave no feedback, so a little different than a Fitbit. After they did that, they were then randomized. So, like a flip of a coin into one of two groups. In the first group, they were randomized to Courage Health, or what we'll call usual care, which is already way above actual usual care, right? They were just to continue in the Courage Health program as prescribed, right? Or has referred. So if they were going, great. If they weren't going, that's fine too. Whatever they were already doing, just keep doing it and make no changes. The other group is our Mind Your Beat intervention. And in this group, participants were instructed to go to at least 3 exercise sessions per week. But here's where we were responsive and gave them lots of flexibility. They could go to the group classes, they could do supervised one-on-one training, they could do the on-demand classes, or anything else Courage Health was offering at the time, right? And we just monitored their attendance in those classes. In addition to that, they came into First Christian Church 6 times over the 12 weeks. This was very similar to Beat Cancer. We started more intense in the beginning and then tapered to home-based. So during these 6 times, they got both group education and these yoga sessions. So during the group education, they learned things like the behavioral skills, physical activity monitoring, setting goals, stress management, and some other topics, right? And then they had a yoga portion where they learned various yoga exercises, breathing exercises, and it included some guided relaxation in there. Halfway through the program, so at the 6-week mark, we came and did another assessment. Then they came back and did a post-intervention assessment at 12 weeks, so following the 3-month intervention. And then we had no contact with them for 3 months, and they came back and did a follow-up assessment. So all in all, participation in the study was 6 months in total. Here's what the eligibility criteria look like. We were specifically recruiting women with a history of breast cancer, at least 18 years of age, not receiving or planning to receive chemotherapy or radiation therapy, and at least 12 weeks post-treatment. All participants had physician clearance to participate. This is generally a big barrier for physical activity programs, getting people to go back to their doctor and get a note. But in this program, a breeze, right? Because they all had referrals. Oh, yeah, or you could go to the chart. Yes, exactly. And she sends it right back. It's amazing, isn't it? So it was actually quite wonderful. And then folks had to be not meeting physical activity recommendations, right? Our goal was to see if we could get, and you were not eligible. I'm so sorry. But we wanted to get evidence so that we could show that it worked. So hopefully in the next version, we can open it up to everybody else. Research is funny like that. They want you to be super strict and controlled on the front end, and then you can loosen everything on the back end. So hopefully we'll roll it out and you'll be able to participate in the future. And you'll know all the things to look for now. So not meeting physical activity recommendations, that is definitely the #1 reason why people were ineligible to participate. So we had 313 people who were interested, including you, Miss Kathy. We screened 78 of those folks. 43 were enrolled in this study. 21 were randomly assigned to usual care. 22 were randomly assigned to Mind Your Beat. Then there's the 6 weeks, 12 weeks, 24 weeks. I will tell you, I have worked in what we call like medically underserved or underserved communities for a very long time. I've worked in rural communities for a very long time. And these are the best adherence rates I've ever seen. So what you can tell is like people are just very passionate, very committed, you know, really want to contribute to the knowledge base around this and generally just enjoyed the program, right? So 100%, you know, return at 6 months is unheard of, right? 82 is still really good. You know, I think across the two, we're at like 90 something percent. And when I present that to folks, people are like, how did you retain 96% of people in your study? And I'm like, it's a wonderful community, right? And they're doing wonderful things. So it was great. Here's a quick look at our demographic characteristics of our participants. So you can see most folks were in their mid-60s, would be classified based on their height and weight as overweight or obese based on their BMI. Most folks were non-Hispanic white, which is representative of the area. High socioeconomic status is what I would say. A lot of folks obviously are retired. That's what allowed them the flexibility to engage in classes during the day. When we look at cancer characteristics, you see most people were in that 0 to stage 2 diagnosis. We had none with stage 3 breast cancer in our intervention group. So that was quite notable because that's not always the case. And then here you can see time since diagnosis and treatment, you know, quite not what we would call like early survivors, right? Mid to late term survivors. And then the only thing that was really different between the two groups were the number of comorbidities. So people in our intervention group reported more comorbidities, diabetes, heart disease, and other things in addition to their cancer. So our main outcomes of interest were changes in leisure time physical activity and changes in psychosocial distress. So I'll present leisure time physical activity first. On the left-hand side, we measured physical activity with self-report via the Godin Leisure Time Exercise Questionnaire. We have the device, but we haven't analyzed it yet. We're still cleaning all that data. But here is the self-reported activity. The line in blue is our Mind Your Beat group, and the line in gray is our usual care, the folks that stayed in Courage Health as usual, right? And weren't given that specific prescription. And here what you can see is there is a time by group difference, meaning everybody increased their physical activity over time, but you can see very clearly, and I'm going to try not to take out this cord, but from baseline to week 12, that's what you want to look at, right? And you can see the blue line, how it steadily increases. That's the program period, right? When they're actively in the intervention. This is the follow-up. So people in Mind Your Beat did a really wonderful job increasing their physical activity over time and then didn't maintain it, right? Not uncommon for physical activity programs. We really struggle with maintenance. So that is definitely something we need to focus on in the future. But still really great from baseline to 12 weeks. Increased physical activity, where the Courage Health group kind of stayed the same, or the usual care group kind of stayed the same. Here's another look at it. This is the number of people. This cutoff here, it means meeting recommendations, what we would consider active. So here at baseline, you can see people in both groups. About 40% of participants report meeting physical activity recommendations at baseline. So self-reported enough activity to meet recommendations or be considered active. And if you look at post-intervention, very little change from baseline to post-intervention for the usual care group. But here's where the big difference is. Our baseline to post-intervention group, about 45% are meeting at baseline to nearly 80% meeting at post-intervention, right? So we were really doing a good job of getting folks who weren't meeting physical activity recommendations to then meet recommendations during this 12-week program. The changes in psychosocial distress look the same, but we're not quite significant. So here you can see in your Mind Your Beat group in the blue line, the little orange line denotes a cutoff of 4. So we use the distress thermometer. It's a scale of 0 to 10 to indicate how distressed you're feeling, right? And a 4 and higher indicates moderate to high distress. And below 4 would be low distress. And so that's what that orange line stands for. So at baseline, you can see everybody is above the 4, right? Everybody's reporting moderate to high distress. Over the 12-week intervention, you can see our Mind Your Beat group dropped their psychosocial distress, but then kind of came up a little bit, but not quite to where they were before. So that's good. And then something really weird happened in our usual care group. They kind of stayed the same over 12 weeks. And then all of a sudden there was a drop in distress, right, at 6 months. So not quite sure what's happening there. Here's another look at it. So this is the percent of people reporting moderate to high distress. So you can see about 2/3 of participants are reporting moderate to high distress at baseline. You can see very little change in our usual care group, but then in our Mind Your Beat group, a pretty substantial decrease in moderate to high distress. So that's a win, right? We were able to improve health a little bit. Here are some other outcomes. I told you I'm a very curious researcher, so people gave me lots of data. And so we asked a whole lot of questions about a whole lot of things. And what I want you to just not worry about all the numbers on the slide, but just to show you everything in red is where our Mind Your Beat group did better than the usual care group, right? And in the right direction. So they reported lower sitting time, fewer problems, lower perceived stress. What's another one? Less anxiety, lower fatigue, overall better quality of life, fewer perceived barriers to engaging in exercise, and greater social support. So all in all, this tells us that maybe our program is feasible among rural cancer survivors. It suggests that it may be effective for improving at least leisure time physical activity and psychosocial distress. And our next goal is to then see if we can do it on a larger scale, right? How do we increase maintenance over time? So that's one of the struggles that we're facing. And then can we broaden it out to a bigger group of people? So you will hopefully see it again, where we do a group randomized control trial and implement it at multiple Courage Health sites, since this was just done at the one. And so I just want to do a quick thank you. I have a lot of people that helped me out with this project. Most importantly, probably the Courage Health team. So thank you, Trevor, and to everybody else involved. My research team, who have been absolutely wonderful. And definitely the most important is all of our participants and community partners who helped make it a success. And then this is just all of the research I do. I do a lot. So Mind Your Beat took place down here on the survivorship end of the cancer care continuum. I do a lot of work in cancer prevention and have dabbled in physical activity during treatment as well, during chemotherapy and during radiation. And so it's a part of a larger body of work to help people move more and sit less. That's all I have prepared for you. And if there's questions, I'm happy to take them. I can stop sharing so I can actually see the chat too. But thank you all for listening to me ramble on for an hour, almost an hour, minus technical issues.
Do you have any questions?
Oh, yeah. What's your question? Does pineapple belong on pizza? That's a really tough one. Start my video. Oh, okay, sure. Can I do that? Oh, Lindsay walked out. It's her video.
I'm sorry.
You know what? I like it too. It depends what else is on the pizza. No, pineapple does not belong on pizza. You know what? I don't like it with ham. That's probably an unpopular opinion. If I'm in Hawaii, then the pineapple definitely belongs on the pizza. No, you can't eat anything there without pineapple. I said, you can't eat anything in Hawaii without pineapple, right? It's in everything. Pineapple rice, pineapple pizza. What else? Yeah.
So how do we translate what we're finding with the success of what the Mind Your Beat intervention? How does that translate into improved maintenance? Like what do we do kind of at a community level to make that?
Yeah. I mean, I think one of the nice things about, I've given this some thought. I think the nice thing about Courage Health is a program that you have access to forever, right? So you could engage with the program if you want to. It's like figuring out what is the secret ingredient that's missing that leads to that drop off. So I think with most physical activity programs, right, we do this program for whatever it is, 12 weeks, 6 months, whatever, the program is. You participate, you're active, and then the researchers up and disappear, and you're kind of just like left to your own devices. And we don't have that problem in this program. So the fact that we saw that kind of drop at maintenance was a little surprising. It could be the people that didn't come back, made a difference in it. So that could be one thing, the engagement piece. We do have interviews now with participants. And so we'll go back to the qualitative data and see, what do people like? What kind of explained why maybe, fell off at that maintenance cliff, is what we call it. But I think that you already have a program. So in my other studies, what we're doing is engaging folks in what we call booster sessions. So there is the opportunity to re-engage in booster sessions. And it's not anything different than what they're already doing, right? Just come back to Courage Health, but maybe it's a special campaign or something along those lines, to get folks to come back one more time. And that might reignite the spark for them or prevent them from, dropping off. I think more in that, what to do in case of a lapse or relapse space could be really helpful. So it's never too late to come back. The program's always there for you, something along those lines, to keep people engaged. But yeah, maintenance is a tough one, right? Because it's like, I can do anything for 6 months, but you want me to do it long-term? That's a little more challenging, right? Yeah.
I was gonna ask if you have tips for addressing the transportation barrier, which can all involve.
That's a really great question. So in some of my other projects, we provide a transportation stipend as a way to reduce transportation related barriers. Maybe a little harder in here, but we've just recently navigated this in Houston. Transportation is also an issue in Houston, right? It's a large urban sprawling city and people come from very far when they want to participate in in-person things. And so another thing that we've learned to do is we will call the services like an Uber, but we work with Alto. Do y'all have Alto up here? But it's another one of these like ride share services, but I can call the car from MD Anderson to go pick you up. A lot of our participants in Houston also use Metro Lift. So Metro is our public transportation company, right? For buses, and Metro Lift will provide a vehicle. The windows are not great, time and all that stuff, but that's another option, right? In rural communities, those options don't exist, right? So we hope that the transportation stipend helps. We were doing a project, so I have another study going on in Longview right now, and we were in Marshall. And so at that time, we were working very closely with the church, and the church was going to actually provide like a shuttle service for people from the church in Longview to Marshall so that they could participate. So I think there could be more opportunities like that in rural communities, like working with existing community organizations, churches where people already go, churches, schools, things like that. You may live in a rural isolated area, but you still come into town for services, right? There's still a centralized school or there's still a centralized grocery store or something along those lines. So I think there are creative solutions that exist in the community. The church one was a new one for me. I was super excited because I was like, you're willing to provide a bus to come participate in my study? I was just so flattered by it. But like tapping into more resources like that, I think is key. And providing money, right? Money usually helps. You're welcome.
So those that were in the study,
Mhm.
they
The
were
Mind Your Beat.
compensated.
Yep. I quit compensating them. You might be right. Yeah. Well, they're not compensated during. So they are compensated at each of the assessments, and everybody is. So the control group was, the usual care group was also compensated. Everybody got the same incentives.
Responsibility
Yes,
for yourself.
sure. It's that,
And after, because you want to, you change a habit after doing it for 6 weeks.
and then you stop. Yeah.
So, no, I mean, but if you do something for 6 weeks.
Yes.
Then more than likely you're gonna
Continue doing it. Mm-hmm.
So it just didn't make sense that many of them.
Dropped out or fell off the cliff.
Sharp.
Yep. I think, there's this other piece. It's like you said, at some point you have to be doing it for yourself, and how to, we call this in our research language, intrinsic versus extrinsic motivation, right? So extrinsic motivation is like something like the financial compensation, right? I'm getting a gift card for doing this, so I'm going to keep doing it, right? It's an external factor that's motivating me to do it. Sometimes like support from your family could be an extrinsic thing, right? If somebody's like, don't you have class today? Right? At some point, we have to figure out how to transition. Like maybe people start participating in the program because of these external factors, but we need to learn how to turn that into that intrinsic motivation. And I think that's what we struggle with a lot, because it's so personal for each person, right? There's no one way to do it for everybody. What makes you want to do something is very different than what makes me want to do something, right? And I think that's the tricky part, because we're trying to do these group-based programs to appeal to the masses, and we haven't mastered how to do that. Plus, do that personalized approach to figure out how to translate this. So I think one of the things that I've seen in some of my other work, I work very closely with churches. I've done a lot of church-based work, physical activity programming within the church, right? And I think in some of my church-based studies, when I, see such high engagement, just like we did with Courage Health, a lot of folks are like, well, I made a commitment to God, and that's what kept me coming, right? Or that's what kept me dedicated. And I was like, oh, that's intrinsic motivation. And I'm like, and I had nothing to do with that, right? Like you came to the table with that. And so, how to tap into that, or, channel that, I think that's the tricky part. Yeah, still working on it.
So instead of getting a referral from your doctor, we need one from the preacher.
I think you need them both, right? But maybe the referral from your doctor is what gets you in the door, but maybe the one from your preacher is the one that keeps you coming back, right? Who knows? Yeah. Yeah. If I could get God to write a physical activity prescription. Yeah. Oh, you're right. Exactly.
Courage Health, it's the first time you go, it's kind of,
I don't want him straight from the camera.
I'm not an extrovert, so it's kind of nerve-wracking. But everybody was so lovely, so welcoming, and the ladies are great. I went home and told my daughter that I just exercised with a bunch of these old ladies, and she goes, "Mom, you are an old woman." I said, "Thank you very much." Okay. But they're just, that's part of the social.
It's a community.
part of it.
Yep.
It's really, and the instructors are just great.
They're fantastic.
Except the one
We
that's-
know that there's,
Well, it's not my fault.
Yeah.
It's the niece.
the secret sauce, right? The Courage Health has the secret sauce, right? I think it's learning what we can do to kind of foster the other stuff to keep people going. And there's a real problem. Like you coming, you attend and you engage, and there's folks who don't. And we have to talk to them too. Like what put you off, or why couldn't you come? Yeah. That's right. Well, hopefully, if we do something larger in the future, we will see you again, Miss Kathy and Georgia.
Thank you.
Yeah,
Thank you.
good. Thank you all. Thank you for the great questions. Anybody online? No? Okay, I'm gonna step away because it's not my laptop. If you want to close the meeting.
All right. Thank you, everybody.
Thank
Really
you.
appreciate it. So we'll have information on the next one coming up. But yeah, thank you all and have a great afternoon.
See at the church today.
Oh, you did? And then just decided